Hi, my name is Amy Allen. I'm the Vice President at the Westchester County Association, and it's my pleasure to welcome you to our latest episode of Business Insights, the online video program we produce in partnership with West Fair Communications. And these Business Insights programs are meant to address topical and timely issues of the day. And I certainly can't think of anything more topical or timely than the Covid-19 vaccine rollout. We are extremely fortunate to have with us two experts who are certainly going to do everything they can to answer, if not all, at least many of your questions. And before I introduce them, I'd just like to take a moment to thank the WCA Platinum Partners, without whose support we could not put on programs such as this. And now I'd like to take the opportunity to introduce our two distinguished guests. We have with me Josh Ratner, Senior Vice President, Network Strategy and Development at WMC Health. Welcome, Josh, and thank you for being here.
Thank you. It's a pleasure to be here.
Thanks. And we also have Dr. Sandra Kesh, Deputy Medical Director and Infectious Disease Specialist for WestMed Medical Group. Welcome, Dr. Kesh.
Thank you, Amy. Nice to be here.
Thank you. So the format for today's show is going to be basically conversational in nature. I will be posing a number of questions to each of our guests. Many of the questions were submitted ahead of time by our members. Obviously, there's many questions out there, and I encourage our viewers, if you have questions for either Josh or Dr. Kesh, please put them in the chat box that you have with whatever live stream platform you're using, and we will attempt to answer as many of them as we can. So I'm going to start and ask a few questions first to Dr. Kesh, and then I'll pivot and ask some questions of Josh. So Dr. Kesh, you're up first. So can you just talk a little bit about the different vaccines that are now available and what are the differences, if any, between them?
Sure, I'd be happy to. So currently in the U.S., we have two messenger RNA vaccines that are available on the market, the Moderna vaccine and the Pfizer vaccine. Internationally, there's a third vaccine, the AstraZeneca vaccine, that has not been yet approved or given what we call emergency use authorization in the US, and that's being used in Britain. The primary difference between the two vaccines really concerns how you have to store them and ship them. There are slight differences in terms of the timing. Both are two-dose vaccines. The Pfizer vaccine requires 3 weeks between the two doses, and the Moderna vaccine requires 4 weeks. But they're both highly effective, with efficacy rates of 94 to 95% after the second dose, which is really quite astounding for vaccine efficacy. And I think that's why many people are so excited that we do have these vaccines available.
So I know we've been hearing a lot about these variant strains of the virus that have been appearing, I guess, in different parts of the globe, and right here in Westchester as well. I guess we've seen a few cases. In your opinion, will the vaccines that are available help against these new variants and ones that we don't know about yet?
Mm-hmm. So that's a very interesting question. So for the British variant, the B.1.1.7, that seems to have already made its way over here and is now the predominant strain in Britain. We do think that the vaccine will be effective, and the mutations that we've seen in the spike protein segment of that code do not seem to impact the efficacy of either the Moderna or the Pfizer vaccine. The South African variant we're keeping a closer eye on, and there was a report that actually just came out a couple days ago that individuals who had recovered from COVID infection, their plasma did not seem to be as susceptible to vaccines from individuals with the South African variant. Now, what does that actually mean in terms of the effectiveness of the vaccine? It's unknown, and our guess is that the vaccine will still be very effective even against that strain, because there are other components of the immune response that are elicited by vaccination other than just an antibody response. So I think the jury is still out on some of the other strains, but I think Amy, that's why it's really critical that we get the majority of people vaccinated.
Mhm.
The longer the virus is circulating and the more people that it infects, the greater the opportunity for additional mutants to develop. And unlike the ones that we've seen so far, these could potentially cause more severe disease.
Thank you. So let's pivot now to Josh and talk about how we get the vaccine actually rolled out there. I know WMC Health was designated as the Mid-Hudson Regional Hub for vaccine distribution. What does that actually mean, Josh, if you don't mind?
That's a great question. I don't mind at all. WMC Health, in addition to being a healthcare network, was also chosen to work with New York State Department of Health and others to help coordinate the logistics, the command and control, the distribution of vaccine. It doesn't mean that we actually have any control over the allocations of vaccine, but what it means is our role was to work with our colleague health systems and hospitals, federally qualified health centers, other providers, physician practices, community groups, a whole host of others, to put together a vaccine plan to ensure that the 7 counties in the Hudson Valley have the best opportunity and the best plan forward to ensure that everybody gets vaccinated. And our goal right now is really to support our Hudson Valley colleagues and really the whole community to make sure that we're coordinating as well as we can the movement and distribution, as well as making sure that no community, no population, no individual gets left behind.
Okay, thank you. So let me just see if I understand how the flow works. So the state has X number of doses allocated for the Mid-Hudson region, and they all come to you for a further distribution. Is that how that works, or does the state also? Well, leaving aside the nursing homes, I know that's a separate distribution channel, but for the rest of the vaccines, do they all funnel to you first?
No. So let me be very clear about that. So the federal government creates allocations. Typically, those allocations to New York State have been, as you've heard from the governor, about 300,000 doses per week for, let's say, the last 4 weeks or so. This week, we received 250,000 doses as a state. Those allocations are then reviewed and distributed to various providers and groups across New York State and the Hudson Valley. As the hub, we don't have any responsibility or oversight of that. What we do is we try to make sure that if, for example, a provider has vaccines and doesn't necessarily have population who's interested in being vaccinated, some of what we do is try to be a matchmaker. We try to move from vaccine from provider A to provider B to ensure that, number one, no vaccine is ever wasted. We never want that. But 2, making sure that it's in the right location to the extent possible. We work with our county executives, our local health departments, and others to try to provide daily insight as to what's happening across the state in terms of vaccine guidance, as well as what the latest intel is. A lot of what we do provides education and answers questions to those who are currently vaccinating and want to know, for example, the guidance changes maybe on a daily basis or a weekly basis. What should we do about this particular scenario? So we're really more a resource than we are, let's say, in control of distribution or anything like that.
Okay, thank you. That clarifies that, because when I think of regional distribution hub, it sounds as though you would actually be distributing it. And in terms of deciding who the eligible providers to receive. Sorry.
I was just going to say, I want to clarify that we're not the regional distribution hub. We're the regional vaccination hub in the sense that we had to put together a vaccination plan.
Got it. Okay, thank you for clarifying that.
Sure.
And then who determines who the eligible providers to receive the vaccines are? Is that still state mandated?
Ultimately, it's the New York State Department of Health's jurisdiction, right? And the state as a whole. Any provider who's currently providing either, I'll just say as an example, there are many physician practices that vaccinate routinely, right? They provide flu vaccinations, et cetera. If there's a group or a physician practice that wants to vaccinate or a hospital, there's an application process that they fill out and then gets submitted, and that then gets reviewed and approved by the state, and then that makes them eligible, and it'll make sure that folks have, the right freezer capacity, they have the infrastructure in place, et cetera. So the first step is that process.
Thank you. Well, that begs the question, Dr. Kesh. WestMed, obviously, WestMed is, as I've gotten my flu vaccine as a WestMed patient from your providers, you vaccinate for a lot of different diseases. What is the status for you to be able to give the vaccine?
Yeah, it's a bit of a frustrating situation for us because we kind of followed all the guidelines and put in place our mechanism and our workflow for vaccine administration as soon as we got the word from the state. And we've really been in a waiting pattern, which, it's very frustrating for our patients. It's frustrating for us. We've now gotten everyone excited about the vaccine. And I think that this is really kind of the problem that we all face.
Yeah, thank you. So, sorry, do you want to add something?
No, I was just going to say it's understood, right? We have lots of, I'll say, physician practices that have a lot of experience vaccinating their patients and the population. The focus that we've been trying to continually redirect on is that this is a public health concern and emergency right now. So what we're looking at as a hub and what we're working with the state on is we look at each county, each local each location, and we look at who currently has vaccine and who needs to be vaccinated so that we can ensure that there is at least current access for the local population. We would love, I think, when vaccine distribution, let's say, picks up and New York is able to get more vaccines, there will definitely be more distribution. But right now, we keep trying to focus folks on, let's just make sure that there is no community that doesn't have the ability. And so that's the best we can do right now.
Thanks, Josh. Dr. Kesh, as we think about getting it out to the population on a more broad scale basis, we hear about herd immunity. From your opinion or expertise, what does that mean, and how many people have to be vaccinated for that to occur?
All right. So the concept of herd immunity is basically focused around what percentage of the population do you need to have immune to a particular disease in order to break that cycle of easy transmission from person to person. And so in the early days when we were looking at kind of COVID version 1, I'll call it, we were thinking that around 70% would get us to where we needed to be so that we could kind of put the masks aside and go back to what we call normal. With the more contagious strains that are now circulating, for example, the British strain, that appears to be anywhere from 50 to 70% more transmissible than COVID version 1. And so when you're looking at a strain like that, the percentage of herd immunity that you need to achieve now goes up to around 90%. And so we're not going to get to herd immunity certainly through natural infection. That would be catastrophic from a public health perspective. We need to really get to herd immunity through immunization. And that's where, really the focus has shifted to how can we get more vaccine out, how can we get it distributed, and how can we get people to really accept vaccination and dispel some of the myths that currently exist out there.
Now, what are a couple of those myths that you hear from your patients?
Yeah. So it's interesting. One of the most common is that the vaccine, because it is a genetic vaccine, is going to potentially interact with your DNA and change your DNA in some sort of permanent way. And I think that, we really tried to get messaging out there that the genetic material in the vaccine actually doesn't even enter the nucleus, which is where your DNA is. And in fact, gets degraded quite rapidly in the cytoplasm after, it is transcribed to do what it's supposed to do. But I think a lot of people, they hear the word genetic vaccine and it triggers that automatic fear. Another common myth is that because this vaccine was developed on, a super speed cycle, that they haven't done all the normal safeguards and safety checks to make sure that it is actually a safe vaccine to administer. And so, what we've reassured people is that they certainly have tested this in a very large population. And by every measure that we have available, it appears to be that both of these vaccines, the mRNA vaccines, are very safe and highly efficacious.
Thank you. I know a question that a number of folks wrote into us about. So, if you've had COVID already, could you or should you still get the vaccine? And if you've had it, how long do you wait till you get the vaccine?
Yeah, those are common questions I get. And the answer to the first question is yes, you should still get vaccinated. When they looked at the studies to see how much of the neutralizing antibody, and again, that's the antibody that actually is going to attack the virus when it enters your body, how much neutralizing antibody is generated by vaccination versus actual infection. It appears as if the vaccine actually generates a much higher level of neutralizing antibody in people who are vaccinated as opposed to people who are infected. And so that is going to give you a much more durable and effective response. In terms of how long after the actual infection can you get vaccinated, we say that, right now we want people to really be outside of that isolation period so that they can get vaccinated. And that's typically 10 days after their symptoms first start. But that you can actually wait 90 days and you will have some degree of immunity for 90 days after the actual infection. And so what I've counseled my patients who have had COVID to do is to actually wait for those 3 months to go by before they get vaccine. That way they don't have to worry about supply. There's going to be more vaccine available and they will have immunity in the interim.
Thank you. So I'm going to go back and ask Josh another question because we just talked about supply. Just want to remind our viewers that if you do have any questions, please post them in the chat box. So Josh, maybe you can help us understand sort of the process flow. I mean, there needs to be a manufacturer, then a distributor, then what? Well, let's start with where does it get manufactured? Obviously, the pharmaceutical companies, is that in the U.S.? Is it abroad? Is it both?
Yeah, so Pfizer and Moderna both have locations within the United States, right? Their headquarters are different than necessarily where they're producing it. Each of them obviously has European partners, and there's obviously manufacturing processing going over there. But essentially, the process at a high level is the federal government allocates each state to have a certain number of doses, and that's specific to both Moderna and Pfizer. Then Pfizer and Moderna will then work with the state to understand where those allocations are going. And we actually get notifications from Pfizer and Moderna here at Westchester Medical Center as an example. We will get a notice from them explaining when we should expect it and the tracking number, as well as from the state to know how many doses we're getting. And then those actual vaccine doses are sent to us from either Pfizer or Moderna directly to us, and then go into our freezers.
Okay, got it. And from your perspective, do you get the sense that they can keep up the pace of manufacturing, and or when do we need to have new manufacturers come on stream to sort of help with that process?
Listen, I think it boils down to federal priorities, right? We've heard the governor say this routinely over the last 6 weeks. Clearly, those manufacturers have the capacity to produce the vaccine. The question's really around the priorities and having the federal government partner with us to ensure that New York State, as an example, or the U.S. for that matter, is the priority. If they're manufactured here, how do we get more of it to stay here? And it's not. I don't understand at this point. I don't believe it's an issue of manufacturing. It's really just a matter of making sure that we get more allocation to New York State and that the U.S. gets it overall. And the governor, I think, has been, again, I don't speak for the governor, nor do I profess to, but I do believe when he says that from our perspective, the more vaccine we get, the more we can get it out into people's arms. And we have built, there are 10 hubs around the state. Each hub has been working with the state on a daily basis. There is plenty of distribution opportunity. At this point, it's really just getting more vaccine.
I know the Governor Cuomo and actually I believe a couple of other governors have reached out to Pfizer, for instance, to see if they can buy the vaccine directly from them. That doesn't seem very likely, or do you have any insight as to whether that might happen?
I don't have any insight. I couldn't comment on that. I think that I completely understand, right? The governor and everybody, even our elected officials at a county level, everybody's advocating to as they should, right, for us as a state. But I don't have any insight as to what's going on beyond that, obviously.
Thanks. So, Dr. Kesh, back to some of them, sort of the medical questions. So let's talk about the vaccines. The ones that we have now are 2-dose vaccines, whether they're either 3 or 4 weeks apart, correct?
Correct.
Can a patient contract COVID in between dose 1 and dose 2? And should you isolate, pretty thoroughly in between? Or what's your advice on that?
Yeah. The short answer is yes. You can contract COVID between the 2 doses. Dose 1 gives you about 50% protection. And that protection really starts to be measurable a week or so after that first dose. So that's certainly not enough immunity to protect you fully. And one of the interesting things that we've been seeing is that a lot of people who get these vaccines, they're very reactogenic vaccines, meaning that they trigger a very robust immune response. And what patients often get are fevers and aches and muscle aches and joint pain, fatigue. And some of those symptoms overlap with COVID symptoms. And so one of the questions that we've had to tease out on the clinical side is at what point do you ask a patient whether, they really have COVID or whether this is a vaccine reaction? And so there is a little bit of investigation that has to go on to determine, at what point do you need to test an individual who's been vaccinated for COVID. So it is a little tricky.
And what about after getting both doses? I've seen some reports where you may not be able to contract COVID again, or can you, but you could still be a carrier of the virus. Explain a little bit how that might work.
Sure. Yeah, and it's a little bit of a counterintuitive concept. So there are some vaccines that can actually protect you against the infection that already exists, but do not protect against transmission. And we don't know whether the COVID vaccines that are currently available fall into that category, or whether they're like your typical flu vaccine, for example, where you get the vaccine and you're protected from both getting the infection and spreading the infection. And the reason they don't have the answer to that question is because they just really haven't looked at what percentage of people who get vaccinated are protected against asymptomatic infection without symptoms. And that's a key question to be able to answer before determining whether the vaccine protects against transmission. In terms of your question about how long after the second dose do you have full immunity, which for both the Pfizer and the Moderna vaccine is 94 to 95%. For the Pfizer vaccine, you achieve that level of immunity about 1 week after the second dose. For the Moderna vaccine, you reach that level about 2 weeks after the second dose. And of course, there is going to be some individual variability from person to person, depending on age and underlying health risk factors.
Thank you. I understand that we do have a couple of questions from the audience, so I'm going to ask for the first one. Well, we did address that. I don't know if you want, maybe this person joined a little later, but I don't know, Dr. Kesh, if you'd like to re-answer that question, because it is important to a lot of your patients.
Yes, absolutely. And, we put out messaging regularly about this. We just don't know. And I don't want to put Josh on the hot spot because I know this isn't a decision of his to make or control. We just don't know. We are completely reliant on the state at this point to tell us when we're going to get vaccine. We have our refrigerators and freezers ready. We have our nurses standing by. I can't wait to put the first dose into one of my patients' arms. It's just up to New York State at this point.
I'll raise my hand and be the volunteer. Josh, any prognosis as to, I guess it's really up to the state, or any sense that you get from your conversations with the state?
Listen, I can't comment because I don't have that information, but I would say that for that individual who's asking, in Westchester County and the Hudson Valley, we are blessed by having the county center now able to vaccinate. Not every region has a mass vaccination site, and we have one that's now up and running for the last week. We're seeing, about 1,000 patients a day get vaccinated there. And that is a huge resource for the Hudson Valley. I think that in the meantime, the most important thing is for that individual to go online and get an appointment and try to get vaccinated there.
Okay, thank you. Okay, let's see the second question. Okay, I'm going to read it out loud. My dad has a COVID vaccine appointment at the county center on Sunday. Is it possible it may need to be rescheduled due to the vaccine shortage? Also, when will Westchester receive more vaccines? I guess that's for you, Josh.
All right. Listen, we've been very clear that we schedule appointments as we have vaccine. If the individual who's asking the question has an appointment on Sunday, there's no need to be concerned that they're not going to have their vaccine on Sunday. So that they should put their mind at ease for that.
Okay, thank you. I have a question actually about it's a 2-dose process, obviously, we just talked about. Is there a possibility that there could be a shortage and that the people who got dose 1, won't get dose 2? And if that's the case, how long can the lead time be between doses for it to be effective? So it's probably a question maybe for both of you.
All right, I can start, and then Dr. Kesh can add. So right now, the guidance that we are working off of is that if you receive the first dose, you will receive a second dose. And we've been intentionally holding the second dose and trying as hard as we can to ensure that everybody who comes for a first dose, we follow up and get a second dose. So there's no indication nor any guidance that would suggest that that's going to be an issue. In addition to that, I know, and this is maybe veering a little bit into Dr. Kesh's realm, so I will dangerously tiptoe and then you can correct me. But over the last week or so, the CDC has actually revised its guidance so that traditionally it was first dose for Pfizer. Between first and second dose, it was 21 days and 28 days for Moderna. They've now relaxed those guidelines on the far end of it to say that it doesn't have to stop at 21 and 28, and if need be, it can extend beyond those dates.
That's correct, Josh. And the reality is that with many of the vaccines that we currently use, hepatitis B being one classic example, a lot of times you're not able to get the patient in for that 0, 1 month, 6 month schedule, and we still find that they're able to mount a measurable and strong antibody response even if you veer off from that schedule. The question of how far out you can go and start to really get a significantly lower immune response remains to be determined. And I think, right now, what I've been telling my patients is if you can get that first dose somewhere, get it. Don't worry about the second dose. 50% protection is better than 0% protection. And that's really, I think, the most important message to get out.
That's great advice. Thank you. I think there's another question from the audience. Okay, presuming unlimited supply, are there currently enough vaccination facilities and vaccinators to inoculate the general population? How long would it take? So I guess that's also kind of both of you. I mean, Josh on the supply and Dr. Kesh about the vaccinators, I suppose. I'm not sure. I'll see who wants to go first.
Well, I think mathematically we looked at it, right? And just using the population, let's use the Hudson Valley as an example. If you look at the current eligible population and you take out the pediatric population, so under 18, there is a certain percentage of the population that will choose for various reasons not to get vaccinated. And that could be, you could pick a number. The national rate right now seems to be about 35% of the country that on survey has declined or would decline a vaccine. So we think that in the Hudson Valley, as an example, there's about 2 million folks who would be eligible for vaccination. And at this point, we believe we're probably around the 5% mark through week 6. I think that as we get more supply, we easily have enough distribution to be able to support the community. It's simply at this point having the federal government send us more vaccine.
I think, just to follow up on Josh's comments, I think the question of, right now there are so many people who want vaccine and such limited supply that it's going to be a while before I think we're holding on to vaccine supply and not able to find people who want it. I think the bigger question of vaccine hesitancy is something that we really do have to tackle. And I wish, there are a lot of things that we've kind of said I wish about with this pandemic in particular, but I think it would have been far more helpful to have had a nationwide public health campaign to really get ahead of some of the messages that have been out there on social media and some of the myths that have been out there around this vaccine. Because I think, unfortunately, for a lot of people, it is easier to listen to the bad news and to the scary stories, even if they're not based in reality. And so, what we have now is a very safe, highly effective vaccine that a lot of people, unfortunately, will not want to get for reasons that really are not based on fact.
All right, I think we have time for one more audience question. Okay, we've heard this a lot. The county center is totally booked. Any advice on what people should do? And I mean, we've gotten, lots of calls and emails, and I'm sure you have both, about frustrations with websites and how do you sign up, and is perseverance the only answer, or any advice? And maybe Josh, you might want to start.
I think perseverance is a good one, right? Just keep checking back, because we are getting new vaccine allocation every week. So at this point, there's not a shortage there. Again, I think it's just folks need to be patient. There is a lot more demand than even capacity at the county center, even though we are really ramped up and I would say humming. At this point, folks should just continue to check back to see if there's additional dates that are opened up. And also check around to the other providers that are available by going online and just checking that. But that is the basic tenet is perseverance and patience right now.
So that's kind of a follow-up question that I'd like to ask. I know this came up in a meeting I was at this morning about where is the state's website the only way to find where you mentioned other places where you could get the vaccine besides just the county center? How does one find where those other providers are?
Well, so in addition to the New York State website, which does have it does have a central resource there, another way would be to check, as an example, the individual provider's website. Many providers have created a landing page, if you will, a section on their website that helps provide COVID-related resources, including vaccine-related resources, COVID testing, etc. Westchester Medical Center is an example where we have a landing page on our website, and I know many other providers and other health systems have done the same.
Thank you. What about at WestMed, Dr. Kesh? Do you have links to where patients can go at the moment, or yeah?
Absolutely. Yeah, we have links for New York residents, Connecticut residents. We have an FAQ section on there that I update pretty regularly. I think that everyone it's a matter of just taking a deep breath, waiting, being patient, like Josh mentioned. I know it's hard. People are very eager to get to the next phase of normalcy. And the vaccine will get us there. I think, a moment of gratitude that, modern medicine was able to create such a spectacularly effective vaccine so quickly, that's been so safe and really performed so well. And now we just have to take a collective breath and just wait it out, continue with the PPE, continue with the social distancing, and we will get vaccines in arms, and there will be an end to this. There is a light at the end of the tunnel, and I think just remembering that every day is what I've been telling everyone to do.
Thank you. Well, I was going to ask for any closing comments, so that sounds like a good one from you, Dr. Kesh, unless you wanted to add anything else to that.
I think I'll leave it at that, and Josh, maybe you can impart some of your wisdom as well.
I'll echo that. I think, listen, a lot of folks are frustrated, and I want to relay that health systems, provider groups, New York State, the Department of Health, the counties, everybody's working together. It may not always come across, but it is very well organized, and they are working together. We are working together. This is not about competition or anything like that. We've seen all of our colleagues across the state come together to rally and try to get vaccine in arms as quickly as possible. I can't emphasize enough that while folks may be frustrated about the speed at which it's going, it's certainly a reflection at this point of only just having a little more patience and getting more vaccine. But we are all working as hard as we can to make sure that it happens as soon as possible. and as
Well,
safe and effective as possible.
I don't doubt that you both are working extremely hard, and we all collectively appreciate that. So I'd really like to thank you both for taking the time from what I know was a very busy schedule to talk with us. So Josh, again, from WMC Health, thank you so much. And Dr. Kesh from WestMed, really appreciate your insights.
My pleasure, Amy. I hope this is helpful.
Yeah, absolutely. And just to let everyone know that this, like as with all of our business insights, this show will be available on demand on our Facebook and LinkedIn and YouTube channels. So certainly check our website for that. And again, I want to take a minute to thank our Platinum partners. And thank all of you for tuning in. I hope that you found this informative, and stay well, stay healthy, and we will see you next time. Thank you.